And now the section of the video that you're probably most interested in and most anxious about: insulin administration. Insulin administration is just an official way of saying getting insulin into your body. We're going to cover 3 types of insulin administration: syringe, pen, and pump. Each method is effective, and each method has its benefits. Just like when choosing a glucose meter, you should choose the method of administration that is most comfortable and best for you. And of course, you should make this choice together with your healthcare provider. Let's start with the syringe. Wait! Don't get up. Don't leave. There's no need to be afraid of this little needle. Through my work with diabetes patients, I know how common a fear of needles is. But I can promise you that whatever it is you're imagining is a lot worse than the reality. There's a reason the syringe is the most popular way to administer insulin, because it's quick, easy, accurate, and practically painless. What you'll need is an alcohol swab, a bottle of insulin, and your syringe. After putting the correct amount of insulin into your syringe, you first have to clean your injection site with the alcohol swab. Then, depending on your body type, if you are thin or of normal weight, you will pinch or gather a fold of skin at the injection site. If you are heavier, you will spread the skin at the injection site. Next, insert the syringe and press the plunger. Remove the syringe, dispose of it properly, and you're done.
I'm going to give myself my injection of insulin. It's very easy, doesn't take any time, and it's painless. My injection sites are behind my shoulder and my upper thigh and in my abdomen. That's fast. No pain, and it's great. It's just like a quick little pinch. I mean, if it's even that, it's like the lightest pinch because the syringes are extremely sharp, so they go right in.
I will get the insulin down to where I'm supposed to have it. Then you take and prepare your the area that you're going to inject. I'll swab this area, and what you do is squeeze the area that you're going to inject. We get the skin and the tissue that's underneath it, and we pull it up. Then take it, squeeze it again, and inject. Don't even feel it. And out. Then you take and swab it one more time, and that's it.
The benefits to using a syringe are: it's quick, it's easy once you get the hang of it, all of the equipment comes in one package, and for now, it's the most cost-effective method for insulin administration. Even though the syringe is very effective, you and your healthcare provider might decide to use a different method of administration. Maybe you'll use something like this: an insulin pen. Pens access insulin that's stored in cartridges that either come pre-installed if you have a disposable pen, or that need to be loaded in by you if you have a reusable pen. There are many different types of pens on the market. Each pen works in its own unique way. So always read the instructions that come with your pen so that you know exactly how it operates. But in general, what you do with the pen is remove the pen cap, load the insulin cartridge if it's not already installed, attach the pen needle and prime the pen. Clean your injection site with an alcohol swab. Then dial the dose of insulin you need and inject. You're done. Then just remove the needle from the pen and properly dispose of it and put your pen's cap back on.
So first what I'm going to do is take off the pen cap, and then I put the needle on, and you can screw it on. So you just screw it on pretty, not super tight, but just tight enough. You have 2 protective caps, the initial one, and then I take off the smaller one, which would then reveal the needle. And then what I do is what's called priming. So I'm going to prime the pen. I tap out any bubbles that there might be, which I can see through this area. And then what I go ahead and do is I just turn it over to the number that I'm going to use. Like today I'm going to use 3 units. So now what I'm going to do is I'm going to go ahead and administer the shot to myself. So you just pinch as much as you can and you do it. And it didn't even hurt a bit. I didn't even feel it go in. 2, 3, 4, 5, 6, 7, 8. You wait about 8 seconds, you release, and then it's all done.
The overall benefits of the pen are: it's convenient, it's simple and easy to use, you get a precise dosage, it's easy to handle for the visually impaired, and it's discreet. You might instead decide to use this to administer your insulin, an insulin pump. The pump is interesting because it delivers insulin to your body in amounts that you and your doctor set 24 hours a day. It does that through a catheter that's placed under the skin. The pump delivers two methods of insulin dosing: basal and bolus. Basal insulin is what's delivered continuously throughout the day and even while you're sleeping, while bolus is an additional insulin dose that's sent from the pump to deal with the carbohydrates in a meal or snack. To send a bolus dose, you would use the buttons on your pump. You've probably realized that the pump is something that you always have to wear on your body. So where do you place it? You would wear it on your abdomen, on the back of your arm, or on the side of your leg. Just like the glucose meter and the pen we showed you, this pump is only an example, and there are many on the market. If you think the pump might be right for you, then talk with your healthcare provider about choosing the best model and learning exactly how it works.
The pump looks somewhat like a pager, and I find it very convenient to use. This is the catheter that I insert under my skin, and I wear mine on my abdomen. And that catheter attaches to this tubing, which you can get in various sizes. This tubing is connected to a cartridge which sits right in your pump. The pump comes in various cases. This is the one I'm using right now, but you can get leather cases, you can get smaller clips. The pump has a computer inside. This particular pump keeps 2 days worth of records. So if you want to manage your insulin regimen tightly, the pump will record that data for you. So that's all very helpful. It makes my life easier. I'm taking less time to keep up with what my diabetes is doing.
The main benefits of the pump are: it's convenient, especially in giving yourself insulin before meals. It provides a summary of all the insulin that has been given, so in case you forget, you can check back through its history. It gives you more flexibility when setting your meal schedule, and you can suspend your insulin dosage if you need to, for example, when you are exercising.